Today I am reading from the book Spirit of Homeopathy, book written by Dr. Rajan Shankaran. Philosophy part 11. What is curative in medicine? In this chapter, we shall try to understand what a remedy really is and what it is capable of curing. This is still a matter of confusion to many, and in my seminar, I could make the matter clear through the following video recorded case. The reader would do well to follow this interesting case and draw an appropriate lesson from it. Case 1. This is a case of viral encephalitis in a female child of a 1.5-year-old. I got the following history. The child was apparently normal when they developed a vomiting and diarrhea, for which she was admitted to the allopathic hospital, where she was given intravenous fluid. Then she developed a mild temperature and had one convulsion. After this convulsion, she suddenly sunk into the stupor and became semi-conscious. The pediatrician said that the chances of child survival were very weak. She was almost unconscious when I showed her and was responsive only to very deep pain stimulus. If we pinch her very hard, she would just emit a slight whine and then go back to the semi-unconsciousness. She had no convulsion after the first one. Her temperature was subnormal, about 97 Fahrenheit. They brought her to our homeopathic hospital with all kind of tubes around her and think venesection had also been performed. And I think this venesection had also been performed. I had to select a remedy to meet these grave conditions. From these very scanty symptoms, no other characteristic symptoms were available. The remedy I chose was the Hellebores niger. Why did I select this remedy? Now, remedy differentiation. The characteristic feature about her case was not what exists now, but how it started. Aconite or belladonna, it would start with the violence. In apis, there would be violent shrill shrinking with the head brought backward into the pillow. On other hand, in opium, there would be completely unconscious with a constricted pupil and stertorous breathing. There is one other remedy that needs differentiations was the zincum metallicum. Zincum and Hellebores are very close to each other. The difference is only one, and that is at onset of zincum there would be tremendous nervous excitement and convulsion. After convulsion, then jogs and then movement, twitching and then coma. So first there is a violent nervous excitement, and then when the nerves get fatigued comes paralysis, stupor and coma. Zincum would not go into the state in the manner of our patient did. The central disturbance of zincum is tremendous nervous excitement. Many times, even in the stage of coma, we will see jerking and twitching in case of zincum. In his lecture on Materia Medica, Kant described the Hellebores as follows. Hellebores is useful in affection of the brain, spinal cord and general nervous system and the mind, but especially in acute inflammatory diseases of the brain and spinal cord and their membrane, and in trouble bordering on insanity. There is a peculiar kind of imbecility or stupefaction of the body and mind. The extreme state is unconsciousness, complete unconsciousness in connection with the cerebral congestion. Even early in the disease of Hellebores lacks the wildness and acute delirium found in the stramonium and belladonna. Hellebores is a passively stupefaction, diminished power of mind over the body. A person goes into the passive state without having any active phase. That is the characteristic of Hellebores. So we give Hellebores 1 m, a single dose. Now what would happen? Let us see what Kant say. I have seen a children after passing through moderately acute but rather passive first stage lie in this stupid state, needing Hellebores for the week before they receive it. When it was given, repair set in, and not instantly but gradually. The remedy acts slowly in this slow, stubborn, stupid case of the brain and spinal troubles. Sometimes there is no apparent change until the day after the remedy is administered, or even the next night. When there come a sweat, diarrhea, or the vomiting, a reaction means a reaction. They must not be interfere. No remedy must be given. Not means don't interfere by giving any homeopathic medicine. They are a sign of reaction. If the child has vitality enough to recover, he will now recover. Now, under label management of the case, this is like homeopathic surgery. We are saying that this child is bad. Her disease is bad. It has affected the brain. We are going to give her the medicine. We want the reaction. Her vitality may be too weak to bear the reaction. That is the risk we have to take. The child may die, but she is going to die anyway. This is her only chance of recovery. And Kant says, if the vomiting is stopped by any remedy that will stop it, the hellebores will be antidoted. Let the vomiting or diarrhea or the sweat alone and will pass away during the day. The child will become a warm and in a few days will return to consciousness. And then what will take place? Just imagine this benumbed finger and hand and limbs, this benumbed skin everywhere. What would be the normal, most natural things to develop as evidence to rousing up of the stupid child? Well, that child fingers will commence to tingle as he comes back to his normal nervous condition. The finger commences to tingle, the nose and ear tingle, and the child begins to scream, toss back and forth, and roll about the bed. The neighbor will come in and say, I would send the doctor away unless he give something to help that child. But just sure as you do it, you will have a dead baby in 24 hours. That child is getting well. Let him alone. You will never be able to manage one of these cases. If you do not take the father into the room by himself and tell him just how the case will proceed, do not take mother to do not tell her word about it unless she is unusual excellent mother because that her child and she is sympathetic and she will cry when she hears that child's cry. She will lose her head and will insist upon the further turning you out of the door. But if you take the father aside beforehand and tell him what is going to happen, explain it to him so he will see it for himself, and tell him that if it is not permitted to go on, that if the remedies interfere with, he will lose his child, means might be death occur. This is the Kant description as to what should happen after giving the hellebores. I gave child of hellebores 1 ml, one dose. One dose and waited for 24 hours, but nothing happened. The child conditions was very critical and I wanted a reaction immediately, so I gave her a hellebores CM. I didn't want to wait with the 10 m and 50 m. Within 1.5 hours after giving hellebores CM, her temperature went up to 103 Fahrenheit and then 105.2. This was her maximum temperature and it refrained for 24. Remained for the 24 hours. The first time she had a kind of conversion along with the temperature, but after the whole thing subsided, her response to the pain stimulus was much better, and the whole things her level of consciousness had increased. This reaction stopped, and so we repeated the remedy in CM. After 2 days and within an hour of the repeat, she started shrinking loudly and she kept on shrinking for 12 to 14 hours. The temperature also steadily rose and remained the same for 72 hours. During the course of this temperature her level of consciousness kept on improving. Every time we give her a dose, the effect would last just a little longer than the previous dose, and then it would subside totally. And after each such rise and fall of temperature, her level of consciousness would just slightly improve, and the symptoms were are identified with the Halaboros started showing. So after Halaboros was given and recovery had begun, the level of consciousness improved. The brain was less affected. Only then could we see this classical symptom of Halaboros, but not when we show her in a beginning. This is very significant point. This case is typically of the Halaboros as it is described in the book symptom by symptom, observation by observation. It is a classical Halaboros case. She started keeping her thumbs clenched and arm outstretched, and she was constantly moaning and rolling her head. Refer to this rubric in the Kant repertory. Head motion, rolling head day and night with a moaning. Her eye was also staring at the one place. Staring stupor during. There was the this is the rubric. This is the rubric. Eye staring stupor during. There was a constant motion of one arm and leg. This is the typical keynote of the Halaboros. Extremity motion involuntary, one arm and the leg. The characteristic feature is that the other side is paralyzed. Then she started perspiring profusely, especially on the head and the upper lip. The perspiration was so much that it made the whole pillow wet. She started getting loose stool, 5 or 6 greenish stool with increased frequency of urination. We noticed that she was very restless and was constantly moving one lower limb while the other limb remained passive. Her nostrils were dilated with a motion of alienation. When we pinch her passive lower limb, she tried to kick away the hand with her active lower limb. The passive limb she could withdraw but not move it actively. So there was a marked absence of power in one limb with vigorous movement of the other side. We also noticed that she was not moving her eye much. They remained still as if she was staring. There was no vision in her eye. If we put a hand near them, there would not even a blinking. There was also hardly any response to sound. Now, this stage improved even further and she became totally conscious. But she could not see and she could not hear. Slowly, her hearing came back, and then we were left with this, that she was fully conscious. She could hear, eat, sleep, cry, but she could not see. Now under the label, doubt about the full recovery. We refer her to the ophthalmologist to see if there was something wrong with her eye or not. But he said that they were perfectly clear. Everybody thought that encephalitis has left its mark, that she would remain blind for the rest of her life. I myself had similar doubt. What should I do now? Should I change the remedy? Then I read in the Nash. Halaboros produced this dullness of the senses, that the eye are normal but he cannot see, and his ear are normal but he cannot hear. When I read this, I felt thrilled. I continue her on a Halaboros according to the indication. Whenever the response lagged, I gave her another dose, and in this way she was treated. I would go every 2 or 3 days to the hospital to see if the vision come back or not. And for quite some time, around 2-3 weeks, there was no sign. Then one day, I took out my handkerchief. I would always do this to check her vision, and waved it before her eye. And for the first time, she tried to grasp it. She could see something blurred. Slowly and gradually, her vision improved until it came back totally. What are the lessons we can draw from this case? Let us look at the pathology of Halaboros. What pathology does to produce and cure? Here are some choices. Encephalitis is inflammation of the brain, and meningitis is inflammation of meninges. There is a third term known as encephalopathy, where another organ of the body is badly damaged. For example, the liver, because of liver failure, toxin get accumulated in the brain and cause a coma. So you can have a hepatic encephalopathy. Now under the label, did Helleboros produce the pathology? Now, which of these conditions does Helleboros produce? It may seem obvious from this case that it produces encephalitis. This means that the action of Helleboros is not on the meninges but on the brain substance. One could assume that apis which produce those shrill cry, means encephalitic cry, could be useful in the meningitis. Therefore, apis is remedy for the meningitis, Helleboros is the remedy for the encephalitis, and opium is the remedy for encephalopathy. Now the questions arise: does Helleboros produce acute inflammation, subacute inflammation, or chronic inflammation? From our experience with this case, would it be correct to say that it produces subacute inflammation? Aconite is known to produce acute inflammation, and Helleboros can be now said to produce subacute inflammation, and chronic inflammation is produced by the chronic remedy like a sulfur. This pathogenesis of the Helleboros now seems to be clear that it produces and cures subacute inflammation of the brain. But we can be happy with this for a short while only till we find it in a cant repertory. Helleboros listed with the 3 mark under the meningitis, whereas it is given only in italics under the inflammation of the brain. What shall we do now with this inflammation? Does Helleboros produce meningitis or encephalitis? It is given under the both. Do you think this is the mistake? If not, then what is Helleboros? What is the site of the action? There is a rubric in the repertory in the mind chapter, love element from disappointed, and again Helleboros is listed in the rubric in italics. Does this mean we should give in a meningitis or encephalitis which has resulted from the disappointed love? Should we use it only in those cases of disappointed love? Should we use it only in those cases of disappointed love where meningoencephalitis is the result? This kind of thinking will lead to confusion. The fact is what? The Helleboros does not produce meningitis and it does not produce viral encephalitis. Viral encephalitis is produced by the virus and meningitis is produced by the organism that caused the meningitis and not by the Helleboros. Disappointed love is not caused by Helleboros but by something else. Helleboros produce none of them. Helleboros produces a state of being, a central state whose main characteristic is dullness of the sensorium. His sense become dull, his eyes are open but he cannot see. This is the central state of Helleboros. And whenever it may be found in whichever patient with whatever name of disease, whether it meningitis or encephalitis, Helleboros and only Helleboros will work, or it gives cure. If the meningitis with the dullness of the sensorium, Helleboros will cure. If it is a viral encephalitis with the dullness of the sensorium, Helleboros will cure. Zincum metallicum produce excitement of the nervous system. So, whether it is petit mal, epilepsy, meningitis or encephalitis, with excitement of the nervous system, zincum will cure. If disappointed love is followed by excitement of the nervous system, zincum and only the zincum will cure. Now under the label, each remedy produces its own type of central disturbance. Helleboros does not produce pathology. It does not affect the brain, nor does it affect the meninges. It produces a central state, a central disturbance, a dullness of the sensorium. Wherever it is found, only Helleboros will cure the case. There was a person following disappointment in the love who was sitting in one place and staring thoughtlessly into the space. His ears were normal, but he was not hearing, and his eyes were normal, but he was not observing. He did not have meningoencephalitis, but he had the state. Then someone sorry, then someone who know the homeopathy, who knew what is to be cured the disease, had the conviction to give him halaboros and cured him, and he recovered with this remedy. Uh, you can see in the repertory. If your mind is concerned with pathology as to which remedy produce what pathology, then you will go wrong. To say aconite produce inflammation is nonsense. Aconite produces turmoil, violence in the central state. Whether this violence followed fright, whether this violence is insanity, meningitis or encephalitis, whether it is a typhoid or whatever it is, painful inflammation of the foot, etc. Aconite will cure this case. If you get a man with a pain in his little toe, so severe that he say, "Doctor, do something, I will die. Otherwise, I will die." You will not look to see whether the site of the action is aconites. Aconitum is a little toe. Aconitum has no site of action. No remedy in the homeopathy has site of action. It does not go and sit in the some site. Potentized remedy have a dynamic effect only. Their effect is central. This central disturbance is to be cured in the disease and not pathology. You can use the materia medica much more freely. You can open it and widen its horizon to the further possible degree. You can use any remedy in any condition if the central actions matches, and you will definitely succeed.